In seeing a veteran as a patient, there are some special issues that we have learned as an organization to make sure we're aware of and do our best to meet the needs of veterans. Certainly, I would leave it to the healthcare professionals themselves who are interviewing patients to find out what in their history, whether it's in their history as a member of the armed services or in some other aspect of their history, might be contributing to the symptoms they're presenting with. But as we look at ourselves as an organization, what we know is many of our veterans come back with post-traumatic stress, or they come back with traumatic brain injury. We also know that it's difficult for the family members of veterans to get care because the VA system serves the veterans alone. So we have developed as an organization a program to specifically treat patients who have PTSD as well as traumatic brain injury, and we treat both the veteran and their family members. Importantly, most of the veterans applying for work here don't have any disability at all. Secondly, those individuals who have a problem as a patient might have an unrelated issue, not related at all to their armed services. But globally, as an organization, what we're trying to do is meet the healthcare needs of the patient population that currently has those needs unmet.
Well, the way I look at military service, it's a job, it's a vocation, but it's a unique vocation, especially those veterans that have served in combat. And combat has a unique effect on people.
Some of the major psychological effects of being in the military are some of the major diagnoses are post-traumatic stress disorder, anxiety-related disorders, sleep disorders, major depression. Some of the traumatic events that they experience result in traumatic brain injuries, and some of the symptoms that they experience then will kind of they'll try to mask some of them or numb some of them by substance use, which then leads to substance use disorders. And then the ripple effect at a different system there is family and relational difficulties. So, because we ask these military members and service members to do a lot, we ask them to be away from their families for a very long time, to deploy to very dangerous and austere environments for extended periods of time with very difficult situations, circumstances to encounter on a daily basis. And that comes with a price.
Nationally, veterans have a wide variety of conditions that they can be experiencing due to their military history. A lot of people know of mental health issues such as PTSD, but there are a wide variety of other conditions they can suffer from. A common one is musculoskeletal injuries. They carry these heavy packs for long distances when they are overseas, and this leads to a lot of muscular problems, especially women veterans. Noise, so when they're experiencing these loud gunfire, maybe loud machinery that they might be serving around, they can develop persistent ringing in their ears, so a lot of hearing loss and hearing problems. Something unique to a women veteran is that when they're deployed overseas, they might be taking contraceptives so they won't get their period when they're overseas, so that leads to a lot of gynecological issues when they want to transition back to civilian life. So there's a lot of different conditions that affect veterans that one doesn't think about until they start asking the questions and getting to know them and getting to know their military experience.
Sometimes somebody will present with a physical ailment and has some emotional and mental related issues that can be addressed, but they're not going to initially come out and say them.
A lot of veterans are hesitant to disclose their veteran status for a number of reasons. One, a lot of veterans are nervous to share because they know they feel there's a lot of stigma associated with being a veteran, that people will assume they have certain health conditions or certain things.
The matter of fact is that most people that have deployed, that have served in the military, are resilient, and they come back and they integrate well into civilian life. That transition is sometimes difficult, but they've sometimes gone through worse in their military experience, and so they're able to transition effectively and efficiently. And it doesn't necessarily say anything about the service members that are experiencing some symptoms. It really is all relative. So if you do ask somebody that, have you ever served or are you a veteran, that would you'd be able to to ask some of those additional questions that would be important for engaging somebody in services that might not usually seek them out themselves.
The Have You Ever Served initiative was started a few years ago by First Lady Michelle Obama and Dr. Jill Biden as a way of partnering with the Joining Forces campaign and the American Academy of Nurses. It was created as a way to recognize and care for veterans that are seeking health care at civilian hospitals and are not necessarily using the VA system. So currently in the U.S. and in Cook County, a lot of veterans aren't utilizing VA resources. They say 75 to 78% of veterans are not using VA resources. So there are a lot of veterans seeking their health care at Rush and other civilian hospitals.
Asking people who come through the emergency department, have you ever served, and thus identifying veterans provides an opportunity to afford them the specific cultural care of noticing that they're a veteran, and therefore asking them more questions about their military history and being able to make referrals to veteran programs such as the Road Home program here at Rush. The national initiative first step is to identify who is a veteran, asking the question, have you ever served? The next step is completing a military health history. So this is going through a series of questions. The main questions we want to ask here at Rush is knowing, when did you serve? How long ago? Did you experience combat? And did you witness casualties? We want to know, were you wounded or injured? And then we also want to know, were you exposed to any chemicals, gases, noise, or other hazardous, harmful substances through your experience? And based off the answers to these questions, this military health history, we're able to get a better picture of your service and ask further questions if anything is triggering a diagnosis or warranting more assessment. And then we have a veteran program housed here at Rush called the Road Home program. And so if someone says, yes, they are a veteran, we can assess if they qualify for this program and provide them with that referral.
And then we'll bring them into our program, house them. We don't expect them to pay for anything during their stay with us. And we'll provide a really comprehensive and holistic care for that veteran.
We have specialists in every area of medicine. And veterans, like civilians, come in with conditions, some of which need specialty care, orthopedic care. They need special joint replacement or special spinal surgery. So we have teams that can deal with the unique needs of veterans. There are medical conditions that they have that I typically will refer them to a medical specialist here at Rush, and they'll get high quality tertiary care, which is pretty unique, I think.
Veterans need to be cared for by the whole health team, not just the physicians and the nurses addressing their medical issues. These referrals need to be made by social work, case management, to programs to help them in an outpatient setting. They need to be involved with chaplaincy if they're facing any sort of spiritual crisis. Their military experience affects their whole life, not just one specific health diagnosis. So it's important to get everybody involved.
In the Road Hope program, I mean, we take that multidisciplinary approach pretty seriously, in the sense that we have psychiatrists, we have social workers, we have psychologists, we have a nurse, we have a research team, we have a nutritionist, we have a yoga teacher, and all that collaboration. People present differently and might disclose information that they might not with another provider, and sometimes that information could be significantly important towards their overall treatment in decreasing the frequency and intensity of their symptoms. So when everybody's on a cohesive team, we can collaborate together towards providing the best care for veterans.
Regardless of where you choose to practice, you're going to come across a veteran. So I think it's really important to take the time to become knowledgeable about veteran health and military experiences that pertain to their healthcare.
It's also important that they need to understand that their experiences are different than civilians. Their injuries are different. The stresses on them were different, and they need to take that into consideration in managing patients.
So just the openness and willingness to learn about that can establish that rapport and create that connection that's integral for a caring relationship.
The "have you ever served" question is being asked in the Rush Emergency Department. But what Rush can work on is getting that military health history completed for every veteran who does come through Rush and who is identified as a veteran. We would love to see every veteran who does come through Rush have a military health history completed so that more accurate diagnoses and referrals can be made.
So I think it's important as a physician who deals with veterans to really understand what their patients' experiences were in the military, how it affected them. They are unique, and that requires a unique approach. And I think we really have that here at Rush.